Welcome to The Explainer. Today, we're going to tackle something that's incredibly common and, let's be honest, just so frustrating: frozen shoulder. We're going to look at what's really happening inside your joint, the steps you can actually take to find some relief, and what that road to recovery looks like. So let's start with a feeling I bet a lot of you know all too well. It's that deep, nagging pain and stiffness in your shoulder. You know, the kind that makes simple things like reaching up into a cabinet or even just putting on a jacket a real battle. If that sounds even a little bit familiar, let's get into what's going on.
All right, so what is actually causing that shoulder to lock up like that? Let's get right to the core of what this condition really is.
Okay, so the fancy medical term is adhesive capsulitis. It sounds complicated, right? But honestly, it's a perfect description. Just imagine this flexible little pocket, or capsule, that surrounds your shoulder joint. With a frozen shoulder, that capsule starts to thicken and shrink, it gets inflamed, and it literally starts to adhere or stick to the joint. And that's what causes the pain and really clamps down on your movement. But here's the good news, and this is really important. This is not something you're stuck with forever. You can take clear, effective steps to start managing the pain and getting that movement back, and it all begins right at home. Now, the first goal here is super important. It is not to force movement or just push through it. No way. The first goal is simply to calm everything down. Before you can even think about improving mobility, you have to get the pain under control. That's why the first step usually involves things like anti-inflammatories, maybe some heat to relax the muscles around the joint, and cold packs to bring down that internal inflammation.
Okay, so once that sharp, intense pain starts to ease up a bit, then you can move on to the next phase, introducing some gentle, consistent exercise. And I have to stress the word gentle. The whole point here isn't to power through the pain, not at all. It's all about carefully and slowly encouraging that joint capsule to loosen up and gradually, bit by bit, restore your range of motion. So what happens if the stuff you're doing at home just isn't cutting it? Well, for those really stubborn, persistent cases, there are more advanced clinical options that are designed to give you a real push forward on that road to recovery.
And you can kind of see how these treatments ramp up, right? It often starts with something like a corticosteroid injection, which is just a powerful anti-inflammatory shot delivered right to the source of the problem. A step up from that is something called hydrodilatation, which is a cool way of saying they inject fluid to physically stretch that tight joint capsule from the inside out. And then, only in rare, really stubborn cases, surgery might be an option to physically go in and release that capsule. It's a very clear progression.
Of course, the big question everybody asks is, how long is this going to take? And look, setting realistic expectations here is just crucial, because getting better is a mental game just as much as it is a physical one. So let's actually look at the timeline for this thawing phase.
You absolutely have to think of this as a marathon, not a sprint. It's just not a quick fix. You see, the first few months are all about getting that pain under control. From there, you move into a much longer phase of actively working, often with a physical therapist, to get your range of motion back. And finally, the focus shifts to rebuilding strength. The whole process can take anywhere from several months to over a year. And that word at the bottom there, consistency, that truly is everything.
Okay, so as we start to wrap this up, what are the most important things to remember? Let's break down the essentials for your path forward. You know, if you remember just one thing, let it be this. It's so simple, but it's incredibly powerful. Every single thing you do, from putting a cold pack on your shoulder to doing a specific stretch, is working towards two very clear goals: relieve your pain and restore your movement. If you keep that in mind, you'll always know you're heading in the right direction.
And finally, this is, without a doubt, the most critical point of all. You can think of this explainer as your map, right? It helps you understand the terrain. But your specific journey has to be navigated with an expert guide. A doctor or a physical therapist is the only person who can give you a proper diagnosis and create a treatment plan that's tailored specifically for you.
So, there you have it. Understanding the problem is that huge first step, and now you have a roadmap. Just remember to combine patience with consistent, gentle effort. If you do that and you get the right professional guidance, you can absolutely work through the freeze and get back to moving freely again.